top clinically relevant articles in the August 2021 CFP Journal. Let's take a look. Can you list 2 major causes of skin diseases and their treatments when it comes to coronavirus disease? So the first one is caused by the virus itself. The August 2021 CFP Journal talks about these conditions. So specifically, there's livedo, there's pseudochilibanes, there's maculopapular lesions, and there's vesicular lesions. The whole separate category is the conditions that are caused indirectly. We're talking about things like maskne or irritation of your hands from using way too much soap and hand sanitizer. Can you think of 3 treatments for maskne? So number 1, benzoyl peroxide. Number 2, retinoids. And number 3, active ingredient wash.
There's one interesting article that deals with MIS-C. So are we missing anything with COVID-19 in children? Multisystem inflammatory syndrome in children, MIS-C. So it's something that shows up in kids who've had COVID-19, either confirmed or after symptoms, 2 to 6 weeks afterwards. And what is MIS-C? The multisystem inflammatory disorder, which can have fever associated with it, some cardiac symptoms, and even GI. So something to be aware of in patients who may have had a diagnosis of COVID-19. Now, do we have to be afraid of this? In some cases, it can have some severe complications. These are still rare. What patients are we more concerned about or should we watch for? It's male patients around the age of 8, often with no other comorbidities. So it's a quick summary, great article in this month's CFP Distilled.
The health of our Indigenous patients. This is a question asked in the August 2021 CFP Journal article on cancer and chronic disease screening. Now, I know not a lot of community clinicians and physicians have the resources that I have at the clinic where I work. So we've got Indigenous elders, Indigenous clinicians, we've got nurses, social workers, mental health support. So what can you do in a clinic that doesn't have all these things? Well, the article makes many suggestions about chronic disease, about systemic racism and overcoming these barriers. Here are 3 practical takeaways that I think most family doctors can do in your clinic. Number 1, provide educational information to your patients about screening. And even better, if you can, provide it in the patient's own language. This can be hard to get, so think about contacting your local Ministry of Health, your provincial or territorial medical association, the patient's own community, or your own cancer screening organizations where you are. Number 2, encourage your patients to have someone else present at the appointment, whether it be an older friend, a relative, an Indigenous elder if they want to bring them. Tell them that that's welcome at your clinic. And number 3, time. Your patient might not want to make a decision on the spot about mammography, colonoscopy, so the article suggests maybe giving a bit of extra time and saying, we can have this discussion at the next appointment if you so choose. If you're a resident or a family doctor, we've got some exciting events coming up this fall and in the spring. Check out vitalfmupdate.com.